the presentation later can go back and look at it. All right, so getting started so that I can be mindful of the time. Again, thank you to the University of Florida Healthcare. I'm just elated to be able to do this presentation and really share all the resources that employees have, especially as they are raising young families and or around young children, grandparents. As the introduction said, anyone is, this information can be useful for anyone. All right, thank you so much. So I'm representing Women's Services Community Programs. Under Women's Services, there's the whole women's service line, of course, our obstetrical services, our delivery services, our inpatient and outpatient, as well as the community arm. And so with that, there are many different programs I'm going to talk about today. And so just to get started, I want to talk about the overall goal of those programs. So collectively, we want to increase access to timely healthcare. So we are a healthcare organization, and of course want that for our employees as well as the community in general. And then also collectively, we want to be able to provide evidence-based education and support services that improve pregnancy and child development outcomes. I always like to say we have the best team in the organization, a very diverse team culturally as well as our backgrounds. And so as you can see here below, we've got nurses on staff, we have a dietitian, medical assistants, staff with different public health, social work, child development expertise, home health. And then we also have two AmeriCorps members. We love our AmeriCorps program. We've had, I actually been a supervisor for the AmeriCorps program for the past 10 years. And it's been a great help and aid to us. And so if you've never heard of AmeriCorps, they are the national arm of like the Peace Corps. So instead of going overseas to serve, they serve within different communities at nonprofits in various capacities. And here we are fortunate to have two highly qualified AmeriCorps members that really allow us to expand our services and our reach in the community. So jumping right into the different community health programs we have here at UF Health. So first, I always like to start out with the Little Miracles program because Little Miracles is the hospital's flagship program, started in 2000 by Dr. Ben Ruby, that really wanted to focus on the rising infant mortality rates that were happening at the time in Jacksonville and surrounding areas. And so Little Miracles encourages early access to prenatal care. So of course, as employees, we have health insurance, but there are a lot of folks out there who don't, or who just need a little bit of help. And so, of course, we have a residency program here. And so wanted to also build that residency program, get people in early. Also, Little Miracle supports women who are hospitalized during the pregnancy. They have 2 community baby showers every year. And that, of course, is open to employees as well as the general community. Parents don't have to be delivering at UF Health to participate in that baby shower that they offer, as well as monthly prize drawing. So they give you a little enrollment card, and on that card, you can document all of your appointments and then turn that card in when you deliver your baby and be eligible for a gift. Also, they will schedule your baby's first pediatric appointment if you would like them to do that as a courtesy. And the number is easy to remember. So if you don't remember anything else, 244-BABY is the number for really all of these services. And so you can always use that number 244-BABY. Then at UF Health, we also have Florida's Connect program. So Connect is that one-stop shop for all home visiting, maternal child health, community resources types of services. So where Little Miracles kind of ends with providing that care and support within the hospital, Connect then extends that and is able to connect employees, families, and the like with additional resources and outpatient case management. So one of those programs is Nurse Family Partnership. We have that one here at UF Health. And Nurse Family Partnership is special in that it caters to first-time mothers and families. And so it's evidence-based. It's been around for about 40 years, long time. And it is nurse-led, nurse-based, and they're able to continue to follow up with you and your family until your child turns 2, those critical early years. And so great program. We're so fortunate to have that program here at UF Health. And then Healthy Start. Healthy Start is Florida's flagship maternal child health program, initially focused on those pregnant women and infants who are high risk. So, if you're having high blood pressure, diabetes during your pregnancy, twin pregnancies, or anything else that's causing you to be high risk, you are definitely eligible then for Healthy Start services. And so Healthy Start also has a new program under its arm called Team Dad. And with that program, our dads are able to also get case management. So we are like elated to have that service on board as a part of the Healthy Start service. And so this is just a little bit of what we offer parents and caregivers at UF Health. But again, just to clarify, with Connect, we can also offer referrals to other home visiting programs like Healthy Families is one of Florida's home visiting maternal child health programs. Early Head Start, we can make referrals to that program. The Magnolia Project is another program, but it's local to Jacksonville. And then we also have one called Seeking Safety, and that program is catered towards our families who are affected by substance use. And we know with the opioid epidemic, you don't have to look far to find someone who's affected or impacted by the opioid epidemic and or other substances, women and families in recovery, so they're able to provide that specific support. And speaking of Healthy Start, before I go on, we provide Healthy Start services at UF Health, but there's other agencies in Jacksonville and throughout the state, really, that provide services. And so within Duval County, there's Inspire to Rise, a great program that also offers Healthy Start services. The Florida Department of Health, all of the Florida Department of Health's, just about all of them in the state of Florida have a Healthy Start program. And in Duval County, Children's Home Society of Florida is also a Healthy Start program provider. So this is the video that I'm going to try to share with you guys. It's a great video. I believe that I have to stop share and then come back to it. But it's only 4 minutes. But even though this video was produced by Nurse Family Partnership, our First Time Mom program, it really is indicative of a family participating in any of the programs, the great support resources that are available. So Wellness, I want y'all to let me know if you can see this and how it's going, okay? Can you still see my screen?
Yes.
Okay. Are you seeing a child with a toy?
No.
Okay. All right. So let's do that. Okay. And oh, I see other folks have joined in. Great. Love it. All right. So now let me go back to, oh, here we go. Okay, now are you seeing that screen with the child?
Yes.
All right, awesome.
When I found that I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse Family Partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated. And that's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas.
I feel like I'm the support for them, but they're learning themselves. And it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helped him with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Vicky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention and outcomes that are of unquestionable public health and social importance.
Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
Okay. Did everybody hear that video? Get some feedback from wellness just to make sure.
Yes, I heard it.
Okay, awesome. So now,
In the midst of applying for
Oh,
residency
sorry.
right now. Good luck. Grammarly has again been a lifesaver with my application, helping me write my personal statement and CV.
okay, and this is being recorded, so sorry about this. All right, let's go back to share the screen to go back to the presentation. Oh. All right. So let's see, is it on from the current side? Okay. Oh, now I need to swap screens again, right?
Yes, ma'am.
All right, great. So we just saw that video. And like I said before, even though this one is produced by Nurse Family Partnership, a lot of the programs have those same outcomes, whether it's Healthy Families, Healthy Start, and you may have know someone who has these same challenges or just needs that additional support, could use that support. And so want to make sure that you all know it could be someone who's having a great pregnancy, but could use that support. All right, thank you. Okay, so now just want to talk to you about another resource that's available on campus. through Fatherhood Pride. We work very closely with them. And they are also the program that sponsors Team Dad under Healthy Start. So on campus, they provide boot camp for new dads. And so we love that. And even though boot camp says new dads, it's for all dads. So dads who are what we call veteran dads, we call our first time dads rookies, our other dads, veteran dads, they can volunteer, be a part of the workshops, help other dads. Then we have 24/7 dad that they offer, and then fathering in 15. They're in the clinic, our OBGYN clinic here on downtown on some Wednesday mornings. And then they're on the postpartum unit here downtown, other days of the week, and our available resource as well. So just wanted to highlight very quickly the Little Miracles baby shower. I know I mentioned it a little bit earlier. We just had one this past Saturday, May 6th. And the next one is December the 2nd. Again, you don't have to be delivering at UF to participate in this baby shower. So any employees who are pregnant, if you're still pregnant in December, please come on out to the Little Miracles baby shower in the LRC auditorium. If you know vendors also who would be interested in sharing their information if it relates to maternal child development, or I mean, we've had like Legal Shield was at our last baby shower talking about the importance of protecting your child's social security number. We've had Mary Kay have a booth talking about the importance of taking care of moms. So it could also be some of those types of vendors as well. And then of course, if you'd like to be a volunteer, we're always wanting volunteers for that event. It's a huge event. It really kind of takes over the LRC atrium and auditorium. And so we're glad to bring that back after the pandemic. So then just also wanted to highlight also services that are available for employees, our breastfeeding, it is virtual, our breastfeeding support, and I highlighted prenatal so that you all would know that this is really the class for you to learn as much as you can about breastfeeding before you get started here on the unit after you have your baby. And as you can see, this class is offered the second Tuesday of each month at 6 o'clock. And then I have the Eventbrite link there to register. Okay, and so now I want to talk a little bit about childbirth classes. So before the pandemic, we did offer face-to-face childbirth classes downtown and at North, but now we are promoting the virtual classes. And it is an all-day, one-time class. Remember to make sure you register and complete that class in the 3rd trimester, 3 to 4 weeks prior to delivery. And so dad also needs to take this class with mom, grandma, whoever's going to be that support person there with her should also take this class. And so then I have the link there if you need to sign up. And when you go to that link, it'll list all the classes that are available throughout the year. Same thing with the breastfeeding and the next one that I have, which is Mommy Mingle. So with Mommy Mingle, it is breastfeeding and postpartum support. So this is your ongoing support for breastfeeding. And, you know, we've got now 2 slides, really 3 that kind of focus on breastfeeding. So you see how important that is here at UF Health. And we want to do all that we can to support you as you learn, as your baby learns, your family even, how to breastfeed and support you in that way. Next, we have employee lactation support services. Want to make sure employees know all the locations that they can go to if they want to pump. And so we're so fortunate at U of Health to have great lactation support downtown as well as at our North Campus. And so as you can see here at the bottom is the breastfeeding support line or helpline 244-2690. So plug that into your phone so that you have it as easily accessible. And when you have concerns that you can reach out to them. If employees are eligible, we also do refer to Florida's WIC program, and that is a program specifically for income eligible folks, but they do also provide some services for people who are not income eligible. And we know that not everybody makes the same amount of money here. So we do have obviously our doctors and nurses and healthcare professionals, and then we have staff who may be eligible. So don't forget about that program as well, Florida's WIC program, Nutrition for Women, Infants, and Children. So this is a picture of some of us at a baby shower that the Little Miracles program had several years ago, but I always like to show it because you kind of see how we have all the vendors in the LRC and take over and, you know, provide these resources to our community as well as our employees. So also wanted to highlight that in 2018, U of Health received the I Am a Healthy Start Silver Award. The awards are bronze, silver, and gold. And so we kind of met that middle ground. And if we tried again, we may actually be at the gold standard by now. But it was because of the things that we do as an organization to support pregnant and parenting families. And so just creating that culture of health and well-being for our workforce. And again, remember, if you ever want to volunteer for our baby shower, definitely, you know, you can let us know and you can volunteer. Okay, so I got a few more slides left. I know we're almost at 12:30. So these are some of the few community partners that we have whether it's Little Miracles, Connect, Healthy Star, or Nurse Family Partnership. These are some of the community partners that we have. So Deutsche Bank, for example, has adopted our programs for probably the last 3 Christmases and made us a part of their Snowflake program and got gifts for kids, for parents, for Christmas. Cecil Pines Adult Community, they are great. So they provide donations for the Little Miracles baby shower, buy diapers and baby clothes. They crochet items for us, baby hats, and all kinds of great things. So we love, 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 and have to shout out our community partners. Safe Kids Northeast Florida, they are our partner for all things safety, including car seat education. So we know that parents have to have a car seat before they're discharged, but knowing how to install that car seat correctly, and also water safety, hot car, all kinds of great things, education they provide related to safety, even low cost car seats actually. One of the, some of the ones I don't have on here are Children's Miracle Network. As you all know, we are a Children's Miracle Network hospital. In the past, they have given us grant money to purchase car seats for families who need them, March of Dimes as well. And recently, some of the ACA programs, United, Humana, Sunshine Health, have given us money to purchase car seats for our NICU babies who are under 5 pounds, and the parent, you know, may not have purchased that car seat for that child. And so we're always looking for grants, always looking for partners. If you have a sorority, fraternity, social group who's interested in adopting us, donating gently used maternity clothes. If you've been pregnant, you've got maternity clothes. If you know someone who, you know, maybe they usually donate to Goodwill, but maybe this time they could donate to us, and we can pass those items along to employees as well as other families who may be in need. Is there a question? Okay, just wanted to make sure. Also in this document embedded is a child care guide from the Early Learning Coalition of Duval County. That guide, though, does talk about Northeast Florida. So it does not just Duval County, it lists resources throughout Northeast Florida. It's a great guide. It talks about what to expect, what to look for in child care agencies, how to find the reports of the different, whether it's misses that they've had, things that they've improved in, or if they're like a 5-star. So it's a great resource to help parents decide what's the best childcare option for them and their family. And then again, I have to remember you're also a partner here, whether, like I said, you're pregnant, not pregnant, grandparent, you might know someone who's pregnant or know of resources, want to adopt one of our programs and support us in that way. So just to kind of bring it home about why we as an organization should support families at work. So I'm not going to read all of these. I know it's a lot on this slide, but just to focus on a few things, it really reflects our values as an organization that we support families at work. And then as we look at some of the cost savings, 1 in 9 babies born prematurely, employers spend more on that one premature baby than on the remaining 8 babies combined. Some of you may know, we do have a high-level NICU here. And so we definitely, may have some employees who have babies in NICU. And then, like I said, you can see the other cost savings. And then our ability to attract and retain employees. So that's definitely a benefit. Reducing employee turnover by, really promoting that access to quality childcare, allowing parents to work and those resources, of course, and increasing employee productivity and well-being. And what's not on here is all the other programs that we have at UF that promote employees and their health. Of course, CHAMPS, our Gator Care, employee wellness. So even though those are not here, just remember that those are there. Also FMLA, if you're eligible for FMLA, if you've been here 12 months or more, thinking about all those other resources that are not on here and reasons why we as an organization should and do support employees at work. All right, so this is my card and my contact information. If you'd like to contact me, and for the sake of the recording, wanted to make sure that anyone else who looks at this presentation later can contact us, contact myself, or Little Miracles program, remember 244-BABY, and be in touch, Any questions, if you'd like to put them in the chat, or if you'd like to mute yourself, you can do that, whatever wellness is agreeable to. And I know we are at time, so you let me know if that is not good.